It is safe to say that some were once known to be safe spaces are anything but safe. Many women and girls can bear witness to this as they are the most vulnerable in this pandemic. They are also the greatest victims of sexual and gender-based abuse, with the government confirming that in Nairobi alone, for the first 5 months of the year, 78 girls got pregnant every day. Add this to the unrelenting female genital mutilation. Helen Aura reports that once again, parents are being called upon to be more present in their children's lives.
With the ongoing COVID-19 pandemic in the country, the government says that women and girls remain vulnerable. There has been an increase in teenage pregnancies, early marriages, and gender-based violence. The spaces that they consider safe are increasingly becoming anything but safe.
The pandemic is hitting already marginalized communities, and it is distinctive impact on the women and girls in our Republic of Kenya. And it possesses risks that society is threatened to step a step back as we keep growing.
According to the Ministry of Health, 1 in every 4 girls from poor families are likely to get pregnant, as compared to 1 in every 10 from well-to-do families. From January to May, Nairobi County alone recorded 11,795 cases of teenage pregnancies, an increase from the 11,410 cases recorded in 2019. This means that on average, 78 girls got pregnant every day on the first 5 months of the year in the capital alone.
About a third of girls in some countries report that their first sexual encounter was coerced. Teenage pregnancies often present with medical complications. Adolescent mothers face higher risks of eclampsia, systemic infections, and puerperal endometritis than older women. Babies born to adolescent mothers face additional risks of low birth weight, preterm delivery, and severe neonatal conditions, as well as physical and cognitive challenges. Unsafe abortions further contribute to maternal morbidity and mortality in this age group.
If gone unchecked, this may see more communities take advantage of the situation by imposing their cultural practices, further cutting short the future of many girls.
The situation has increased slightly, and our message is even one pregnancy is a concern to the nation because it contributes to one's poverty. As it has been said here before, every time a girl gets pregnant, and years in schools are reduced, and it contributes towards the poverty of those families.
By the end of March, cases of gender-based violence had increased in the country by 33%. And by the end of June, the Ministry of Gender records an increase of the same cases by 55%. This goes to show that what would naturally be a safe haven for many has now turned into a nightmare.
We are now getting reports that the home environment has own unique challenges that was never anticipated. Some homes are not safe, thereby creating situations where perpetrators and victims of gender-based violence spend more time together, unfortunately. Because when you live in your home,
the government intends to put an end to female genital mutilation by 2020 and teenage pregnancies by the year 2030. This will need a lot of restoration of the glory of what are safe spaces turned pockets of torment. Helen Aura, NTV.